the equipment needed to deliver albuterol solution, a small volume nebulizer or your breath actuated nebulizer, and then of course a peak flow device, right? Cool for what's going in there, and the pulse oximeter, excuse me. Around your neck will be your stethoscope, on your wrist will be a watch and or a calculator in your pocket if there isn't a calculator and a stopwatch or something on your watch. There's a space for documentation. Try to remember what time start was. Time start is when you walk in the door, take note of what time the scenario started. There's space for your vitals, heart rate, respiratory rate, breath sound, sputum, and SpO2. We'll be giving you that information verbally, or you'll be looking on the vitals monitor for that information. Before the scenario starts, you just came in, you flipped it over, and you're like, crap, I got scenario number 5, you know? You're gonna take it in, take a few moments to kind of make a game plan in your head. Then you can go grab your equipment or take a seat and answer the questions at the bottom. Either or, take a seat, answer the questions, get your equipment ready. I don't care, as long as you're answering the questions before you actually engage treating the patient. These questions involve things like, what is the mode of action for albuterol? What are the prominent side effects or precautions of interest with this drug? This is where I want to see a really well detailed answer. What is the approximate FiO2 for the nasal cannula? Rule of 4s, right? Okay, this should be easy points. What is it?
36.
36. We start at 24, 28, 32, 36. So maybe you want to review your rule of 4s, guys, if you could come to that very quickly. What is the range of FiO2 for a nasal cannula?
6.
What is the range of FiO2? I've seen that plenty of times. Make sure you look at what the question is asking you, not what the liter flow range is. Let me pull up the rubric simultaneously.
On which one? On the nasal cannula? That one was 36.
So, you answered your questions at
Oh,
the
the
bottom.
range is
effectively.
24
Me and
to
Miss Parity will have the rubric in front of us, your name at the
44, I
top.
think it was.
I'll point out now that the rubric, it's 36 questions for the actual assessment, or 36 points for the actual assessment part. It's worth, no, this is the old one, 3 points for the questions. So if I don't like your mode of action answer, I'll probably deduct 3 points. So that's only 6 out of 9, assuming you get those 2 right, because typically it's gonna be about 3 questions for the written part. So 3, 6, and 9. Okay. So that means what's 85%? How many questions can you miss?
So Ms. Bernie, we write that part out, those 3?
You can't get less than 39 out of 45, guys. So that, 6, but you can't miss more than 6 questions. Let's go back to the scenario. So you're coming into your patient's room, doing your AIDIT. Hi, I'm Lily. I'm going to be your respiratory therapist for the day. It looks like the doctor ordered some oxygen therapy for you, an albuterol treatment, and we have something called peak flow to help determine what your status is with this asthma. Is it okay if I verify your name and date of birth? Joe patient, 51042. Okay, let me take a look at your ID band, make sure that medical record number checks out. By the way, we're using Hal Jr. Obviously, he's not born in 1942 because our adult mannequins are out of commission, unfortunately. So once you're ready to actually treat the patient, which one do you want to prioritize giving first out of your orders? Oxygen. Miss Bernie likes giving oxygen first. If you want to justify doing peak flow first to me, saying something like, I want to get a good baseline idea of where you're at, let's go ahead and check your peak flow first. Or, seems like your oxygen levels are fairly low, why don't we go ahead and start you on oxygen therapy? Because I will check their vitals. With that information, I'll be able to make that decision on which to offer first, oxygen or the peak flow, right?
Wait, so you do vitals first, and then you can decide if you want to do peak flow or oxygen first?
Correct.
Oh.
So your vitals, which you guys are all expert at now. You can check the heart rate at the wrist, make sure you're shifting your attention to the chest rise and fall. And then we'll go ahead and check our breath sounds, 6 in the front, 6 in the back. Make sure you're asking your patient. I see students forget this one all the time. Make sure you're asking if they're coughing anything up, because you have a whole section where you need to know what their sputum production is. The amount, the consistency, the color. And I'll give you that information. Oh, I'm coughing up like small, semi-thick, pale yellow. Small, semi-thick, pale yellow, right? So you have that space for your pre-vitals here. Then you'll make your decision of peak flow or oxygen therapy. Do we know how to coach somebody on peak flow? Do we know why we're using peak flow? In order to make sure we're offering appropriate diagnosis to our patient. I can get an idea of what their current asthma exacerbation status is like. This person only has a history of asthma, so I'm fairly confident that they're not going to be terribly ill. So I'll give you a peak flow pre. You'll do your treatment. You'll coach your patient on how to receive a treatment and why they're getting that albuterol treatment, right? Then, of course, you have to do your peak flow post, right? To get an idea of whether or not what. Why do we do peak flow after a treatment? To see if the medication did anything. So I'll offer you peak flow vitals, a peak flow number post. It'll likely be a number that indicates, yeah, it works. So you can tell that to your patient. Wow, seems like it's helping. Let's go ahead and get you situated so I'll come and visit you again within the next 4 hours, right? Or as needed. Beautiful. What's that, Sam?
So you know how you said that you do peak flow and then start them on oxygen and then give them the albuterol? Would you have to take them off of the nasal cannula and then give them the albuterol? Or
You would not.
no?
That's a good question to consider because the nasal cannula, it's going in the nares, right? The albuterol treatment, it's going in through a mouthpiece.
Oh, okay, yeah.
What if they were on an air entrainment mask that's covering both the nose and the mouth? You would have to tell your patient, let's go ahead and pause that therapy while I offer you this treatment, but don't worry, the treatment's offering oxygen. I'll be monitoring your oxygen. We'll get you right back on your air entrainment mask as soon as the treatment's done. Good question. Let's take a look at the rubric, see where we're at here. So you walked in. I want to see you use your hand sanitizer and don some gloves. I'll have gloves at the bedside. Yeah, I have gloves on both rooms. I'm just making myself. So easy points. 4 points right there. Identifying the patient. 3 patient identifiers. I know that 2 is fairly standard, but I want to make sure you guys are in the habit of the 3. Name, date of birth, medical rec number. And you'll get full marks if you're doing your AIDIT when you walk in, which is pretty much identifying the patient and then acknowledging them and letting them know what you're in the room for. Just a quick preview. Wouldn't you want to know, why is this person in my room? Well, I'm here to do a quick breathing treatment and get you some oxygen, and we'll go through that as we're going through it. I won't be in here for more than about 15-20 minutes. Educate the patient on therapy, the how and the why, right? This is the old one. I'm sorry, guys. I'm gonna upload the newer version of this. So that just means that you're showing me that you have affixed it to the patient appropriately, that you coach them effectively on how to use it. Then afterward, you're following up with your procedure. It's very similar to the ones you've been doing, guys, where it's just making sure they're comfortable, recording that information. Then when the scenario's done, you're gonna offer me your sheet so I can verify your answers, and we'll tally it up. So it is gonna be out of 55 if I'm gonna upload the newer one. So that means you can miss 7 questions, I think. Oh, no, you can miss 8. Yeah, that's part of why 40, 55, 47. Oops. Yeah, you can miss no more than 8. Okay, what's up?
Quick question. So I know this is probably like self-explanatory, but so we're using 2 separate devices, the nasal cannula and the small volume nebulizer. I know one is set at 4, and the other one you should probably, for the small volume nebulizer, you should probably set at like 8.
Correct.
Do you use separate ortho tubes then? You don't use the same connector? Or
No, you would have to
use this
disconnect the nasal cannula so you can connect it.
So then
You're
for
just
the-
not removing it from their face,
Yeah.
was per
Oh.
Sam's question. You can
Okay.
leave it in place.
Okay. Okay, perfect. Thank
Okay.
you.
Good question. What else? Okay, now let's actually physically work out this second one. This is not part of the pool. This is not one that you could potentially get. It'll be this is exactly how it's set up though. You have a patient that's gonna be given to you, Joe Schmo, date of birth 5/10/42, ID number. You're offered a situation. This patient has chronic bronchitis. His blood gas reveals pH 741, CO2 59, KO2 61, bicarbon 32. The physician orders for respiratory care practitioner are as follows. 3 things. Oxygen therapy at 28% to keep SpO2 greater than 88%. Notice how it's not telling me what device to use. But there are devices that provide, if you're being asked to give precise FiO2, then you know you have a couple of options, right? What is it? The coolness or the Venturi. Which one do you think is the best option for somebody with chronic bronchitis? The Venturi, because this is a type of COPD patient when they have chronic bronchitis, so we know that air entrainment masks are going to be a good option for that person. So this is the type of scenario you might see where I'm not offering the exact device I want you to use, but the doctor is asking for a precise FiO2, so that'll be your prompt to say, well, I need to pick a device that delivers precise FiO2, so clearly it's not going to be a nasal cannula. It's not going to be a central mask. I need to choose the one that I know delivers precise FiO2. He's also asking for albuterol 2.5 milligrams Q6 plus PRN, and then Advair 250 over 50. So, you'll take a look at all that, you have your space for charting, then you can take a seat and answer your questions at the bottom. What's the mode of action of albuterol? What are the prominent side effects of the precaution or precautions of interest? What is the mode of action of Advair? What are the prominent side effects or precautions of interest? Now, the mode of action of albuterol, you answered already, correct? Is albuterol in Advair, or a version of a bronchodilator, something like it, right?
Yeah.
You don't have to write out that whole spiel again for me. You can say something to the effect of, please see above, except note that in Advair, there's a long-acting beta agonist in it. Makes sense, guys, what I'm offering you there? So you can save yourself a little time. You can, when it gets to that point, you'll just say, okay, well, I know in Advair is salmeterol and fluticasone. So you can write out for me the mode of action for salmeterol, and then the mode of action for fluticasone. Or, because you've already identified the mode of action for albuterol, a short-acting beta agonist, you can just tell me, please see above, but please note that salmeterol is a long-acting beta agonist. And I'll appreciate that you understand that they're the same drug, same class of drug. Interpreting the blood gas, easy squeezy, right?
Metabolic alkalosis.
Partial compensated or
Full.
fully compensated metabolic alkalosis with Leah? PO2?
Oh, I guess, what is that?
Severe almost.
It's moderate. No, it's mild. It's mild. I don't remember. So it's a fully compensated metabolic alkalosis with mild hypoxemia. Right? If you guys can't see, why don't you guys come up close? I didn't know you guys couldn't see this whole time.
Oh, no, listening is doing the trick, just,
Got it.
I couldn't, yeah.
Okay. And then you're going to justify your decision. Since I didn't offer you which oxygen device to use, what oxygen device did you choose and why? So if you do come up with some really good justification for why you wanted to use a pill aerosol, I'll consider it. But it's likely, since this person has chronic bronchitis, that you chose the Venturi mask, right? What's up, Tuna? I'm gonna be your respiratory therapist for the day. Is it okay if I verify your name, date of birth, and medical record number? It's Joe Schmo, date of birth 5/10/1942, ID number 246810. Great, that checks out, wonderful. So the doctor asked me to come in here today because it looks like we need to give you some oxygen therapy and albuterol treatment and something called Advair, 2 different medications and some oxygen therapy. Have you ever received any of those? No, I haven't. Okay, no worries. We're gonna go through each of them as we kind of work through them so you understand what's going on. Number 1, is it okay if I check your vitals, please? Let me check the vitals, so I'll go ahead and throw the pulse oximeter on my patient, turn it on. While it's loading, I'll go ahead and get my fingers on my patient's wrist, get my counter out so I can make sure I'm assessing that within 10, 15, 30 seconds. You can use the whole 60 seconds. So counting. I counted 14 in 10 seconds, so 14 times 6. 7, 14, 20, 28, 30, like 84? 80 something, right? 87? I did that too quickly in my head. Thank you, sir. 14 times 6 is 86. Cool, my heart rate's normal. So, once you have your heart rate, make a note in your head of what that is. Bring your attention to her chest rise. I saw 3 chest rises and fall in 10 seconds. So 3 times 6 is 18. So now I can take my hands off her wrist and go put some information down on the sheet. Heart rate was 85, or what was it?
84.
84, and then the respirations were 18. Checking the pulse ox, looks like the pulse ox at 87, 84, 87. Seems like it's correlating well, that's why we're doing both assessments. But the pulse ox is also gonna offer me that SpO2. So then you can make a note of the SpO2 as well. You'll be checking Miss Parity. If you have her, I'll have those vitals on the monitor for you if you have Hal Jr. And of course, she will modify what those values are supposed to be because her values are gonna be different than what chronic bronchitis patients would be. Okay, looks like your vitals are checking out. Have you been coughing anything up, Mr. Joe? Yeah, I've been coughing up like small, thin, white secretions. Oh, okay. Perfect, thank you, sir. All right, I think what I want to start with you is your oxygen therapy. This device that we're going to use is called an air entrainment mask. Basically, we want to use it for you because it will offer you this this high flow of oxygen, that will deliver the oxygen at a precise rate, which is really important for someone like you with chronic bronchitis. I want to make sure I'm not giving you too much oxygen. It has to be an exact amount. And this device does that for you. We're going to go ahead and set this at 4 liters per minute. Checking for the flow. Okay, this goes right over your head. Is that comfortable, sir? Great. So next what I want to do is give you this breathing treatment called albuterol. Have you ever had albuterol before? That's okay. I'm going to go ahead and set up this small volume nebulizer. It's a device that's going to deliver that treatment for you. Pretend to put the medication in for me. Basically, this albuterol treatment, it's a bronchodilator, which means it's going to help open up your airways to make it easier for you to catch your breath, which seems like you do have trouble catching your breath sometimes because of the chronic bronchitis. It's something we use in emergency, so if you ever feel like you need to use it as needed, you can always call me and we can come help you out. But it looks like the doctor ordered it for every 6 hours, so I'll be visiting you after 6 hours after this visit too. Now what I'm going to need to do is go ahead and get you off your oxygen therapy while we're doing this. So I'm turning off the oxygen flow, so it does not like loud at the patient. Plugging this in. Okay. The way to take this, sir, is you're simply going to breathe like normal. Just keep that mouthpiece in your mouth, breathe normally throughout the duration of the treatment, and then occasionally take a nice big deep breath for me. Maybe every 5th or 6th breath, that'll help to really get that medication deposited deep into your lungs. Make sense? We're gonna go ahead and get going. Can you kind of show me that you understand what we're talking about? Demonstrate to me that you understand how to take this treatment effectively? And they will. Okay. So it's been about 10-15 minutes. I hear that the medication's sputtering, sir, so we're going to go ahead and turn it off for you. And I'll go ahead and pause this therapy for you and get you going on your Advair. And as soon as we're done with this, we'll get you go back on your oxygen therapy. I just want to make sure I have your mouth still exposed so we can do this treatment that you need via mouth. Now this medication is Advair. It's a combo drug. It's called Advair because it has salmeterol and fluticasone in it. That just means it has a medication that's long acting and it has this corticosteroid in it that's supposed to help kind of alleviate your symptoms over a long period of time. It's a maintenance drug, we like to call it. This one's a little different from the one that you just took. It's a dry powder inhaler. The way to take it is by opening up the side port with your thumb here. There's a nice little spot for your thumb. Keep looking at somebody as if they're here. So you open it up to expose the mouthpiece. Once you're about ready to take it, you're gonna click back on this little port here to pop open the medication. But now that it's popped open, you have to recognize that it's ready for you to receive it. So once you are ready to receive it, please be cautious not to tip it to its side so we don't lose the medication. So just keep it up forward as if you're holding a hamburger. What I'm gonna need you to do is take a big breath out, blow all the air out that you possibly can. We call it the FRC, but I just wanna see that you're blowing all the air out possibly. Then you're going to bring the device up to your lips and take a fast, deep breath in. So it kind of looks something like this. I'll show you. And once you have that breath in, go ahead and hold your breath for about 5 to 10 seconds, no longer than about 10 seconds. And then you can release. And then we can go ahead and try that one more time just to make sure you got the full dose. But then once we're all the way done, I'm gonna go ahead and ask you to rinse and spit with some water. Because in this device, there's a corticosteroid, and I'd hate for that corticosteroid to linger on the base of your tongue, because it could potentially cause oral thrush, which is a type of yeast infection. So hearing that you're identifying a precaution there. Okay, so it looks like we're done with the orders that the doctor prescribed. We'll go ahead and get you back on your oxygen therapy. Comfortable? Fantastic. All right, let me go ahead and check some post vitals now. Same thing, heart rate, respiratory rate, breath sounds, and SpO2. All of that will check out effectively. All right, looks great, sir. So it looks like the next time I'll see you will be in about 6 hours, but you are ordered for this treatment as needed, so you're welcome to call the nurse if you do feel like you need me here sooner than that. Otherwise, if there's anything else I can do for you, please don't hesitate to ask. I'm just gonna go out and go ahead and chart this information that we just went over. Thank you and have a wonderful day. And then clean your